Good morning, everybody. It is 7:13 right now, and welcome to the Orthopedic Minute. And joining us in studio right now is Dr. Barron Bremner. In studio with us, Jackie.
Absolutely, and we're talking about your hips today in a very interesting procedure. So, doctor, thank you so much for joining us this morning
Thanks
on
for having
Iowa
me.
Live.
Thank you.
Okay, so what exactly are we talking about today with the Orthopedic Minute?
Well, the part that we're talking about today is kind of a fast track or rapid recovery hip replacement that we've been doing at DMOS for about the last 8 years.
Okay.
And it's really cut down on the amount of hospital time they need to spend and the decrease the pain afterwards, and also it's been shown to get people off crutches a lot quicker.
There you go. We're going to talk exact numbers here in just a matter of moments, but when it comes to hip replacement surgery, over the years, this has really made leaps and bounds in advancements and how safe hip replacement surgery was, because I should say, because back in the day, it wasn't 100%.
Well, sure, and still nothing's 100%, but yeah, it was a lot longer, protracted recovery, much longer incisions, a couple decades ago. Really in the last 10 years, we made a lot of leaps and bounds with the anesthetic and with the surgery procedure also.
I was going to say, when you first started, you said a hip replacement that's quick and a fast recovery. I'm like, those terms don't always go together when you're thinking of hip replacement. So talk about this new innovation and why this is so unique.
Okay. The innovation happened because the older approaches used to remove part of the muscle off the back of the hip, and then you'd have to let that heal afterwards. So typically that required about 6 weeks on crutches, and even then you weren't guaranteed that it would heal. And so the newer approach, we go between the muscle planes, and that way when we're done, the muscles just go back together.
Okay, yeah, we're looking at a diagram here to show you the ball in the socket, right?
Right, and so for any kind of hip replacement, we take the ball off of there and put a new ball and socket joint in.
You just take it off.
Yeah, so the ball is the diseased part.
And you have it here. You have what a piece looks like here.
Yeah,
so
this
we can show that.
This would be the socket, and it's got a roughened exterior.
Okay, we can show that.
That goes into the pelvis, and so you'd remove the rotten or the roughed up cartilage in there and put in a new socket, and then the bone grows to it.
Okay.
And then on the femoral side or on the thigh bone side, you remove the ball, and then you put a new
so it has
stem
a little rod in there for more support.
And the bone grows to that. And
I had no idea.
So traditionally we had to remove a lot of the muscles and make a pretty long incision to do that. Now we can get by with about a 4.5 inch long incision and go between the muscles.
Wow. I didn't realize you put almost like a race in here, and that you put the ball in. That's really interesting.
As I say, the technology of what the ball and the socket have been over the years has changed dramatically.
It has,
as well,
especially the plastics have improved dramatically, and that's just like any kind of bearing surface, it can wear down, but the plastics wear a lot less now. And the balls, which were only metal in the past, now they can be metal or ceramic, and the ceramics have a tendency to wear less too. So
really? Now, how is the ceramic when it comes to strength compared to a...
That's a great question. Actually, there was a problem with the ceramics back in like the 60s and 70s.
That's exactly what I was hitting at earlier.
They were very smooth, but they would break, and that's virtually unheard of now. And so the actual metallurgy or the composites that they make now are really durable.
Wow. Oh, can we talk about some common hip problems that might lead you to wanting to consider something like this?
Yeah. Well, it's somewhat age-related, so typically when somebody comes into my office, they're less than 30 and they're having hip pain. And a lot of people say, hip, and they might point to their back. That's pretty common.
Right.
But so that's a lot of times their back, and we need to work with physical therapy and things like that. But more the groin pain, that's a lot of times a sign that something bad is going on in the hip. And so a younger person, it might be a cartilage tear or a muscle strain, or it could be arthritis, but it's less common. An older person, my age or older, we start to think about is the ball and socket wearing out, and we can sometimes treat that with a stem cell injection or a cortisone injection or a scope, or sometimes we have to, if the joint's at the end of the road, sometimes we have to do this.
Okay, now a question I have about that. What is this something that is hereditary? If your grandfather had problems and your dad is experiencing problems, is this something that you could probably count on?
Yeah, I wouldn't give up hope, but it does run in families. It's not like, blue eyes or anything like that, that genetically linked, but certainly for knee replacements and knee arthritis, it does run in families really strongly, and hips are somewhat strong like that. But a lot of times it's activity related. You were really rough on them early on, and you've been rough on them your whole life. They'll wear out.
Okay. All right. So you have it replaced here. We were talking about how fast the recovery is, and traditionally, how long did it take?
Well, when I was just coming out of training, at Mayo Clinic, we had people in the hospital for 4 or 5 days on crutches for 6 weeks. That was about 10 years ago. Now I'm sending people home the same day, or if they don't go home the same day, they go home the next day.
Seriously?
Wow.
Yep. And we're doing them as outpatients in our outpatient center. And then people are on crutches. I kind of insist they use crutches for 2 weeks, but a lot of times they stop before then. But I'd like them to just take it easy for 2 weeks, and that's why I tell them 2 weeks with crutches. But a lot of times they come into the office carrying them in their hand.
That's pretty incredible. I want to go back to where you're talking about the symptoms of hip pain, because maybe people don't always recognize that that's where the root of that problem is, and that ball and socket can wear over time, whether it's age or other things inflict that. So talk about, again, if you're feeling certain things, you might need to go talk to a doctor and say, this might be a different root or source of this problem.
Well, if you've given, obviously I always say you don't need to run to the doctor within like 4 days of your symptoms, but if you've tried your anti-inflammatories and some stretching and changing what you do, and this has been a month or so and things are bothering you, typically it'd be a deep pain in the groin, or it can be radiating pain from the groin down to the knee. That's pretty common for a hip joint.
All right.
You should certainly talk to your doctor. If you have, low back pain, or what people sometimes call hip pain towards the buttock, that could be a sign of a pinched nerve in the low back, things like that, and you can certainly have that looked into as well.
All right. So again, so many things to consider here, and boy, what advancements have been made in hip replacement.
Oh, that's my thing. I can't believe the advancements of how small the incision, 4 inches, and the difference you can make with the technology of the ball and the socket and the recovery. Amazing things to check out. If people want more details on how to pursue something like this, what do you recommend?
Well, they could look at our website, DMOS.com. They could call our phone number at 515-224-1414 and just ask to see somebody who specializes in hip replacements.
And be able to take care of you.
Yeah.
And realize it, because I think a lot of people don't think about it because they're like, I don't want that burden in my life, because they think of what the recovery used to be or the pieces that were involved, but things have changed greatly.
Yeah,
and we have that access here in Des Moines.
Yeah.
Dr. Barron Bremner, very nice to meet you. Thank you so much, buddy.
Thank you very much.
Thanks, Jackie.